alaikum. This is Jahangir and you are watching Medical and Nursing Lectures. Dear learners, today I am going to present some multiple choice questions regarding fundamental of nursing.
So here the question number 1 is, the nurse is planning care for a client. Which intervention would be appropriate to reduce the risk of infection? Option A, assess vital signs only once daily. Option B, raise the temperature in the client's room. Option C, wash hands. And the last option is wear a mask for all client care. Here the correct option is option C, wash hands. What is the daily calorie requirement for an adult with average body weight? 1500 calories, 2000 calories, 3000 calories, or 2500 calories. Here the correct option is option D, 2500 kilocalories. You can see the recommended daily nutrition requirements for different age groups. So in the last you can see that adult average requirements is 2320. Which enzyme helps for the digestion of fat after emulsification? Renin, amylase, lipase, trypsin. So here the correct option is option C, lipase helps the fat to digest and then absorb. The nurse wants to protect a client from developing an infection. Which action should the nurse take to break a line in the chain of infection? Option A, cover the mouth and nose when sneezing. Option B, place contaminated linens in a proper bag. Option C, use personal protective equipment sparingly. Option D, wear gloves at all times. Here option A is the correct one. Nurse should cover the mouth and nose when sneezing. Which of the following is known as the protein factory of cells? Ribosomes, cytoplasm, Golgi bodies, or DNA? So here option A is the correct one. Ribosome is known as the protein factory of cells. The nurse is preparing to provide morning care to a client. What should the nurse explain to the client is the reason for daily bath? Option A, assess skin integrity. Option B, develop a nurse-client relationship. Option C, moisturize the skin. The last option is stimulate circulation. Here the last option is the correct one. Option D, stimulate circulation. The building blocks of proteins are polymers of glucose, vitamins, amino acids, or starch. Here the option C is the correct one. A client has a nursing diagnosis risk for impaired skin integrity related to immobility. Which nursing intervention should be identified for this client's problem? Encourage the client to eat at least 40% of meals, keep linens dry and wrinkle free, restrict fluid intake, turn client every 3 hours. So here the option B is the correct one. Nurse should keep the linens dry and wrinkle free. Recommended protein requirements of an average adult male person: 1 gram per kg of body weight, 2 gram per kg of body weight, 1 milligram per kg of body weight. The last option is 0.8 mg per kg of body weight. So here the correct option is option C, 1 mg per kg of body weight. Malnutrition comprises of following forms except undernutrition, overnutrition, imbalance, or micronutrition. So here the correct option is option D, which is micronutrition. The nurse has recommended that the client has orthostatic hypotension. Which assessment finding would support this assessment? Decrease in blood pressure when moving from supine to standing, decrease in the heart rate when moving from supine to sitting, pale color in the legs when lying in bed, or complaints of dizziness when first sitting up. Here the correct option is option A, which is decrease in blood pressure when moving from supine to standing. How much calories per day requirements by breastfeeding women? 1000, 1800, 2200, or 2700? The correct option is option D, 2700. The nurse is admitting an older client to the care area. What can the nurse do to promote a safe environment for the client? Keep clutter to a minimum in the client's room, have the clients wear terry-cloth slippers, provide adequate lighting, turn off alarms to reduce noise. Here the correct option is option C. The nurse should provide adequate lighting to all the patients. Which of the following is an example of primary poverty disease? Chickenpox, typhoid, dementia, or malaria? Here the correct option is option D, malaria. Which of the following is a rich source of vitamin A? Orange, apple, groundnuts, or apricots? Here the correct option is option D, apricots is the rich source of vitamin A. Although the carrot is also a rich source of vitamin A, but the apricots have also a lot of vitamin A. Which of the following contents are high in hind milk? Fat and vitamins, vitamins and minerals, fat and energy, protein and energy. So hind milk refers to milk at the end of a feeding, which has a higher fat and energy. So here the correct option is option C, fat and energy. The milk of which of the following mammals has highest content of fat? Here they are talking only about the fat. So option A is buffalo, option B human, option C goat, and the last option is cow. So here the correct option is option A, buffalo have a higher content of fat as compared to the others. Which disease is caused by the deficiency of protein? Pellagra, marasmus, beriberi, rickets? Here the correct option is marasmus. Option B is the correct one. Which of the following statement about rice is false? Milled raw rice contains low amount of vitamin B. Husked raw rice is a poor source of calcium. Option C, hand pounded under milled rice is a fair source of vitamin B. Parboiling of rice causes loss of thiamine while milling. So here option D is the correct one. Parboiling of rice causes loss of thiamine while milling. How much calories will produce during the fat breakdown metabolism? Option A 9 calories, option B 2 calories, option C 5 calories, and the last option is 7 calories. Here the correct option is 9 calories. Option A is the correct one. Which nutrient deficiency is main reason for microcytic anemia? Folic acid, amino acid, iron, or vitamin C? So first we should know about the microcytic anemia. Microcytic mean that the shape of the RBC becomes less than the normal. So here the correct option is option C. Due to the deficiency of iron, one can get microcytic anemia. How much BMI or body mass index score for obesity? 20 to 25, more than 15, more than 30. The last option is less than 18. So if you look at the chart of BMI, so here it is been mentioned that more than will be counted in the obese. So here the correct option is option C. Which diet is commonly prescribed after intestinal surgery during heartburn, gastric ulcers? Liquid diet, blend diet, gluten-free diet, low-fat diet? Here the correct option is option B, blend diet should be recommended. Which type of the following food is rich in omega-3 fatty acids? Option A, oily fish. Option B, chicken. Option C, pork. Option D, egg. Correct option is option A, oily fish. The nurse is applying restraints to a client after securing a healthcare provider's order. What should the nurse do? Assist the restraint every 10 minutes, pad bony prominence, secure the restraints to the side rails. Option D, tie the restraints with a square knot. Correct option is option B, pad bony prominence. Which one of the following is known as poor man's meat? Option A, cow milk. Option B, soya beans. Option C, apple. And the last option is chicken. Here the correct option is option B, soya beans is known as poor man's meat. Which of the following food items believed to be complete meal or balanced diet? Vegetables, fruits, milk, and honey. So here the correct option is option C. Milk is known as a complete meal or balanced diet. Proteins are made up of simpler chemical substances called glycoproteins, amino acids, minerals, glycolic aldehyde. The correct option is option B, amino acids. Which one is the example of indirect intervention? Managing patient environment, administration of IV medications, providing oral hygiene to the patient. Option D, insertion of nasogastric tube. Here the correct option is option A, managing patient environment is the example of indirect intervention. You need each type of skill to implement direct and indirect nursing interventions. For the application of such interventions, you need which skill or skills? Cognitive skills, interpersonal skills, psychomotor skills. The last option is option D, all of the above. So you need all of the above skills for applying any kind of intervention. Develop a trusting relationship, express a level of caring, and communicate clearly with the patient and his or her family. This defines which skill or skills? Cognitive skills, interpersonal skills, psychomotor skills, or all of the above. So this one is the example of interpersonal skills, or this is called interpersonal skills. Here option B is the correct one. This provides a mechanism to help nurses define, explain, and measure the result of nursing interventions: assessment, nursing diagnosis, planning, and evaluation. Correct option is option D.
Thank you for watching. Please subscribe the channel and press the bell icon for getting the updates.